Hello, I'm Robert, fact checker and science blogger, and I focus on helping people who are scared of things. And in this case, it's about I want to go into the background as to the issues that happened in China very early in its response. This is Wenliang, and he was a whistleblower. And it is absolutely true that China didn't have laws in place to protect medical whistleblowers. And then he was investigated by the police for spreading what they thought was disinformation. Now, what people do not often report is that in response to the public response to that in China and outside, then Beijing brought in the first ever laws to protect medical whistleblowers in China. So they're quite limited compared with whistleblower laws in other countries, but they do exist. And if on the investigation it's a legitimate thing that they were whistleblowing around and it wasn't disinformation, then they will not be harmed. They will not be chastised. They will be rewarded for whistleblowing. So that's a new thing that's come out of that, and most people don't report that. Now, the other thing that most people don't report is the very short time scale. So the whistleblowers warned about it on the 30th of December, and then on the 31st of December, the automatic system for detecting a cluster of atypical pneumonias was triggered. So they only spotted it one day before the automatic system. As soon as their automatic system for detecting SARS-like illness occurred and triggered the alert, they then told the World Health Organization. So they probably wouldn't even have saved that one day, because this is China in winter, 1.3 billion people, loads of different, not just flu, you get lots of different seasonal winter forms of disease, respiratory diseases. And that was for the United States, not China, but it's the same idea. And it's very difficult to spot a pattern. And the United States can testify for that, because remember at this time, the Chinese had no way to test for COVID. Whereas in the United States, they did have a way to test for COVID in February, March, or ever since January. By late January, China was testing anyone with flu-like symptoms throughout China, 1.3 billion people. And then by 28th of January, Singapore, which is very close to China, got lots of connections with it, cultural connections, they were testing everyone with flu-like symptoms. And the United States were nowhere near that. Even in March, they had only done a couple of dozen or so cases per state throughout the entire United States. They just missed a huge outbreak that was already there, and they just didn't see it. And looking back at these clusters of atypical pneumonias earlier in the year, which could well have been COVID, there's no way to know, because they didn't have the same alert system that the Chinese had. So I think you can be pretty certain that if the Wuhan, it's because of the Chinese previous experience of SARS. We were very lucky that it happened in China, it didn't happen in the United States, it didn't happen in Brazil. So in the 2019 pandemic simulation, a tabletop exercise, then they did an exercise of a coronavirus pandemic starting, I think it peaks in Brazil, and this would have spread much further than the Chinese one before they detected it, because the Chinese have this surveillance system in place. So when they talk about, the Chinese, they because of this whistleblower, they lost one day, they're missing out this other side of things. That because of this automatic surveillance, they got it much faster, and because the whistleblowers were very alert and aware also to SARS. So the same doctors, a doctor in the same position, seeing the same situation in the United States, wouldn't think of SARS, you see, wouldn't think of a coronavirus. They wouldn't have the same keyed up and alert to clusters of atypical pneumonias that they were in China. So you need to bear that in mind. And this Wenliang, he eventually died, of course, of COVID, but I think we can be pretty certain that it would not have been detected so quickly almost anywhere in the world. China had the best system for early detection of COVID in the world. And their system maybe was the little glitches in it and it was a day late or something. But you've got to bear in mind this does happen in pandemics, in epidemics, that these things happen. And there's no evidence that China was trying to cover it up. There were mismatches and things, but remember, out of 1.3 billion people, a little cluster of a few tens of people, however many it was 40 or something, and detecting that was really quite a remarkable achievement, actually. Finding some needles in a stack of pins or something. Then it was really quite impressive that they found it so quickly. So please, let's think about it like that. And then when people keep on saying to the World Health Organization, you should chastise China, remember they don't say a bad thing about anyone, except once they did with China with SARS when they delayed it by some months. With SARS, that was a very serious thing that China did wrong, and the World Health Organization sort of rose to their, very politely saying that you've done that. You should have let us know. They said, if you looked at it, it's very muted what they actually said, and that's the highest that the World Health Organization will actually go. Throughout the pandemic, they never criticized the United States for not picking up on their pandemic, on their epidemic in January and February. The World Health Organization not said a single word to the United States about why didn't you pick up those cases. They haven't said a single word to the United Kingdom for why we abandoned test, trace, isolate in March. They haven't said a single word to Brazil about Bolsonaro. So the reporters kept bringing this up about Bolsonaro and how he's not taking it seriously. And the World Health Organization didn't have one bad thing to say about him. They just talked about, in general terms, about how best to respond and giving positive suggestions about what Brazil could do to do a better response. So you can't expect the World Health Organization, it's just not the way they work. They would not be able to cooperate with the member governments to the extent that they do if they were to go around blaming everyone for all the things they do, the mistakes they make, or the political things that arise. That is not how they do. They just don't operate that way. And so now I'm going to go to another thing, and this is about the human-to-human transmission. And the World Health Organization actually published an alert on the 5th of January, and the CDC themselves on the 7th of January. And Maria van Kerkhove, who's the technical lead for the science team on studying COVID for the World Health Organization, and she's got previous experience with SARS and MERS, and she as soon as this was reported, immediately that was her first thought: is there going to be human-to-human transmission? Anyone who's got a reasonable experience in the CDC would have immediately thought that on the 31st of December. They didn't need anyone to tell them. So this whole thing about saying, the World Health Organization should have warned us about human-to-human transmission. They indeed themselves, they did publish a health advisory on the 7th. And then the whole thing is put around this tweet. And there's this tweet that about a study that it was just reporting by the World Health Organization, reporting a study that said that they hadn't found any evidence of human-to-human transmission. But on the very same day, the World Health Organization themselves said that there is evidence of human-to-human transmission. It said she warned of limited human-to-human transmission, mainly small clusters in families, that a super spreader event in a healthcare setting is possible, with potential of wider spread. She said we need to prepare ourselves. That's on that very same day, 14th of January, as that tweet. And that was only 2 days after the virus was sequenced. So remember, China did all this before they got the tests. They didn't have tests available before, and they already knew what they'd got. And the United States missed it with tests already published 2 months before, or a month and a half to 2 months before, and China and the United States missed it. So the virus was sequenced, and then they very rapidly did the PCR tests. And it's really, you can only really properly study human-to-human transmission once you've got good tests to be able to check that it really is COVID. And so it really was remarkably fast response in China, and remarkably fast how they got to that point. And it's absolutely absurd to think that one tweet on the 14th of January would lead the US CDC in the US conclude that there's no risk of it infecting humans. And then by the 21st, 22nd of January, then Dr. Tedros had gone into Wuhan. He actually did a personal visit to Wuhan at the height of the pandemic, just before the lockdown. And then he came away and he talked about what he'd found, and the World Health Organization gave their findings, and they were warning the world already in January that you've got to prepare for this. This is serious. And then they were saying that we've got to do surveillance. We've got to check people with flu-like illnesses. And Singapore was already doing that by the 28th. But the United Kingdom, I'm not so sure if we've even done it ever, got to the point where anyone with flu-like symptoms, we are now, if you're asked to be tested for COVID, but it's very, very sloppy compared with China and the United States and the World Health. So I listened, going way back to January. People in our group got scared very early on, so I was listening to every single World Health Organization press briefing starting in January. And then originally they had 5 of them a week, all the working weekdays of the week. Then it went down to 3, and then eventually it went down to 2, which is the situation we're in now. And then they started adding the social media Q/A's in the middle of that on the Wednesdays. I've watched all of those. And in the January, February, March, they were saying, so in January they were, and in February they were looking for donations to help them with their response in Africa, and Europe was very generous there, and they were amongst the earliest big donors. The European Union gave them over $100 million for their not 100 billion, sorry, over $100 million for their response, and very early on, and that really helped the African countries to prepare, and that's partly why Africa was so ready for it when eventually it got to it, partly from the support of the EU. But the EU was very complacent, and they felt their own health system was fine. I was there listening, and just about every single press briefing, day after day after day, they were saying the people with advanced healthcare, it's going to stress them, they've got to get ready, they've got to get the personal protection equipment long before we even realised it was an issue. The World Health Organization were warning early in February that the rest of the world has to get their personal protection equipment, and they've got to get stocks of it, and they were warning about that, and they were warning that you've got to get your testing capacity, you've got to ramp it up like Singapore did on the 28th, and we definitely have the technology. We could have ramped up just like Singapore did. They were testing everyone on the 28th, and we still struggling. But back then that was everyone with flu-like symptoms. There wouldn't have been that many because but there would have been a fair few because of the end of winter, but it would have been we could have, they were just going to, we have these taking samples from the influenza network, and their advice was to put in testing for COVID-19 into that sample collection, and we didn't do that. I actually tried doing a petition to the UK government to do that. It never actually got approved for the petition process, but I tried sending emails and saying, we've got to do that, and we just never did it. And then eventually they abandoned the test, trace, isolate as well, and before only just a few dozen cases, I can't remember, a very small number of cases, they said we can't trace so many people, which was nonsense. And it's just that the system they hadn't built up. So the World Health Organization was saying, you've got to build up your capacity for tracing. The reason the United Kingdom couldn't do it is because they hadn't listened to that warning a month earlier to build up their capacity for tracing and be ready to bring in new tracers. That's why they abandoned it, because they didn't listen to the World Health Organization, and because the World Health Organization warning about the surveillance and so on. So if we look at this, look at China. China did a very fast response, and they ended it very quickly over the whole of China. Most of China, for instance, Tibet only had one case ever. Now, people say, oh, but there could be hidden cases. There can't be many, because if there were, it would have been spreading. There would have been other cities, and there would have been we see how quickly it spreads. Like I'm in Scotland, and we were down to 1 per million cases, and then they just let up a little bit, and it grew like anything. And China, if it had just had 1 per million in Tibet or other of its remote provinces, and they weren't completely down on it, then it would have expanded like that, and it didn't. So it's pretty clear that they did eliminate it in China, and they're now right back to normal, and they don't have to do the physical distancing. And it's the same for New Zealand, which followed the advice of the World Health Organization. So what I'm saying here is that I think actually China and the World Health Organization have been criticized for saying that China did an excellent response. They were just being accurate. China did a very excellent response to this. None of this says that it is not, it's a separate matter. We're talking here about the doctors and health workers in China, the medical establishment in China. We're not talking about what they do about people's freedom of religion. We're not talking about any of the other establishments in China. We're talking about how the medical establishment, which are the same as doctors everywhere in the world, health workers like everywhere in the world, their focus is on saving lives. And there's a very strong focus also on containing it in China to save lives in the rest of the world. And so when the World Health Organization say that China did an excellent response, they mean specifically the Chinese medical establishment, the health workers, the tens of thousands, 10,000 people, probably teams of people that all went from all around China into Wuhan and risked their own lives to stop this pandemic in Wuhan. And these are the people who stopped it very quickly and who the World Health Organization say gave an excellent response in China. So don't think about them as praising the Chinese government, although the Chinese government did, because they're authoritarian, that may have helped, but they were, well, a single party system anyway, they very quickly were able to roll out the same approach throughout the whole of China. So they've had an advantage there. But it's the medical establishment who were very, very prompt, very careful, they put their lives into it. They risked their lives to save lives. And that is what the World Health Organization are praising in China. And they did an excellent response. And you shouldn't denigrate what they did on the basis of other things that Chinese have done that you quite rightly criticize. I think we shouldn't tar them all with the same brush. The medical establishment in China, its response was absolutely excellent, superb. I think there's no doubt about it. And they actually have a quite high level they have a very high level. For instance, the team that was visiting China, then they remarked about how they had, for instance, artificial lungs, which are especially useful for very challenging cases for COVID-19. And we don't have the same numbers of artificial lungs in hospitals in the rest of the world. So we're using ventilators, and we don't have access to the same number of artificial lungs that the Chinese had back then. Artificial lungs are useful in a situation they allow you to oxygenate your blood without having to go through the lungs. So they oxygenate the blood, and your lungs, if your lungs are being stressed in some way, and they're especially useful for people who have kind of difficulties with their lungs, and maybe some very elderly people. It's a bit difficult to know whether they're most effective in the very elderly or the younger. But we not only don't have some reduction of those, but we have problems with enough ventilators as well. And the World Health Organization were warning about all of this back in February, about the lack of equipment, the lack of intensive care unit space. They warned about and the lack of test, trace, isolate, quarantine. They've got to have supported isolation and quarantine. They've warned about the possibility of deaths in supported living, like the care homes. The UK discovered that for itself, even though there were warnings coming from Italy, warnings coming from the World Health Organization, and yet we just stopped testing, and we took hardly any care about the elderly people in the care homes, and then we discovered that lots of them die. And there were people before that, John Ashton, for instance, who'd been following the World Health Organization, and he was saying this is appalling what you're planning to do. But nobody listened, because they've just had the mindset, flu pandemic, we know how to do a flu pandemic. And so an analogy, I think, is like we're trying to reinvent the wheel, but the wheel that we've invented is square wheels in terms of how it responds to COVID-19. It's going clunk, 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 clunk. And the Chinese had already invented their wheel for dealing with SARS. They have a round wheel, so they have a very streamlined wheel that was working very well. And we're not learning from them about how to build the right kind of wheels to deal with COVID-19. We're clunking away with our square wheels and gradually learning that you should round corners. And that's basically how we're dealing with it in the United Kingdom. We've still got an appalling response. Very few people are isolating, very few people are physically distancing, very few people are doing the masks properly. That is why we ended up in lockdown. And very few people are isolating or quarantining. And the government is not giving support to the isolation or to quarantine. The Chinese very early on, when all they had were PCR tests, and the Chinese had a 4-hour turnaround time. If you went into hospital in Wuhan in January, remember that's in January, just not long after they had finished the gene sequencing, they immediately developed the PCR test. It was the 11th of January that they had gene sequencing. It wasn't so far long after that. And they got to the point where the PCR tests, they had so many PCR tests, and they were all ready to do them, that you could go into a hospital in Wuhan, and you would be sitting there waiting there for 4 hours, and then you get your PCR test in 4 hours. We're not achieving that in Europe or the United States today, and the Chinese were doing that in January. So you waited there, and then as soon as you got your PCR test, you were isolated. And if you were positive, you were isolated. If you weren't positive, you could go away again. They didn't let you out of the hospital after your test. You stayed in the hospital, then you got your PCR test. If you tested positive, you're put in a COVID-19 isolation ward. And that is the way to really stop it. And we're not doing here in the United Kingdom, and people at home who have no training in looking after COVID-19 patients, they have no training in using personal protection equipment, and they're not even using any personal protection equipment, not even surgical masks, are looking after their spouse or the people in their house at home who they know have got COVID-19, who may be tested positive, and they're taking, in many cases, no precautions at all. And that is another reason why it's spreading, because 70% of people with COVID-19 don't give it to anyone. And if you can isolate quickly, if you can quarantine contacts quickly, anyway, I've talked about that before in my other videos. I think I'll stop here because I've got plenty of videos talking about that. But so I hope you can understand now that China did do things that were wrong, but so did just about every country. We're talking about medicine here. We're not talking about human rights. We're not talking about freedom to express your religion. When you're talking about medicine, China did an excellent response. And Brazil did an appalling response. The United Kingdom did an appalling response. Especially given that it got so much information it could have used from the rest of the world. The big problem is the United Kingdom is not, they should pick up the phone, Boris Johnson should pick up the phone to Jacinda Ardern and to Taiwan and to Laos and to China and to everyone and say, how do you do it? We're not succeeding. Something's going wrong in the United Kingdom. What is your advice? How did you manage to do it? Because we're not managing to do it. But maybe it's, who knows what it is, for some reason they just don't feel they can do that, or they're not doing that, and they're just having to learn. And so they build these apps which are based about flu. With the contact tracing for COVID-19, then your contacts are almost always people that you have talked to within 15 minutes. You don't need these apps. You can actually do the contact tracing yourself without a contact tracer and without an app. Your contacts are nearly always the ones, if you could stop all the ones that you've been talking to within 15 minutes without proper physical distancing, then the pandemic would just go off a cliff like that. You don't need these fancy apps, although they do help with jogging memory. That's about it really. And just sitting together in a park bench where you're not talking to each other, you're not going to give them COVID. So They're just not learning from other countries. And so, anyway, that's it. I don't want to keep. I'm keeping these short. Hopefully, that's not too long. So the main thing is that we should learn from China, and China did indeed have a really excellent response on the medical side of things, and we should bury all our political differences. We should, as Dr. Tedros said, we should quarantine politics. That includes the political differences between countries. We shouldn't stop listening. We shouldn't say, oh, China's a political rival, so we're not going to listen to their doctors and nurses. That's wrong. There are a huge amount of wisdom in the doctors and nurses and the epidemiologists and health workers in China, which we can learn from. And there's a huge amount of wisdom in New Zealand, but I'm saying even with countries who've got very big political differences, but medicine crosses those distances. Health workers everywhere are trying to save lives. In China, in the United Kingdom, in the United States, everywhere. And we should have medicine without borders. Medicine without the political differences. Wherever there's good medicine, we should be learning from the good medicine. Wherever it has succeeded, we should learn from where it succeeded. And we shouldn't say, we're not going to learn from China because they are political rivals and we think that they don't have freedom of expression of religion, and they have these human rights issues, so we're not going to listen to their medicine. That makes no sense. The health workers have the same intent to save lives in China as everywhere in the world. This is one thing, and in North Korea, World Health Organization, because they focused on health, then they're welcome everywhere. They can go into any country. They can go into China, they can go into North Korea, they can go into Iran, they can go into any country in the world. The World Health Organization is welcome there because they're there strictly as scientists and as doctors. They keep confidentiality, and just like you don't blurt out secrets of your patients if you're a doctor or a nurse, then you have confidentiality when you're World Health Organization and you're talking directly to the government of North Korea and China. And they have a kind of almost like patient confidentiality is how they treat it. They will not blow out things, but they will call out things if it's something very serious. But they will mainly, if they talk directly to them, and they'll say this, they talk directly to them. They want to know if there's something is there. So if the disease is there, the World Health Organization is not going to hide information about there's a disease spreading there. But and the countries all know that. But the World Health Organization does not go around saying to countries, look, you've got private confidential information, you did this very wrong. I'm going to tell the whole entire world because you did wrong. That is not how they do it. The World Health Organization does not operate like that. And it's very much like doctors with patients and the medical confidentiality, that they need to know lots of details in order to help these countries, and these details are confidential where it's appropriate for them to be confidential, just like it is with a doctor and a patient. And that's why it is totally inappropriate to ask Dr. Tedros to say bad things about any of the countries and to tell them that how bad their response is. That is not where they're at. They're in the business of learning how to do the medicine, how to save lives, how to advise countries to save lives, and they find out what are the things that do but save lives and save health and the better medicine, and that's what they focus on all the time. And all this politics has nothing to do with the World Health Organization, and they should not be dragged into it in this way, because they literally can't do anything anyway, because it's not their remit. So anyway, I hope this helps, and I'll upload this. And my previous one was, my voice was rather quiet. This is a little bit louder, and hopefully it'll be a bit clearer, and it's also a little bit, maybe a bit more streamlined what I said.